As we even support our children, we need to manage our own anxiety. As we've said when we were talking about the infants, the child feeds off our emotions and they take their cues from us. So we should try as caregivers, as parents, not to transmit your fears or your stress to the child. Yeah. So that is also very important. We should watch out for catastrophic thinking. When we think that it's just going to be bad, it's just going to end, immediately somebody gets sick, that's the end of everything. We should just stop imagining the worst, because when we do, of course, this is a message that we send to the children. When we are anxious, can we try as parents or as caregivers to avoid talking about these concerns in front of our younger children who do not understand the current situation? If you feel at any point that you're overwhelmed, you can step away, you can take a break, yeah? And then this will calm you down, and when you return to the child, you're calmer and you're in a better place to deal with them. So other things, limit your consumption of TV. There are also friends that give us a lot of anxiety and share a lot of panic. When somebody maybe has had someone get COVID and it was serious, you find that a friend calls you, one friend after another calls you and tells you things, and you begin to get more and more anxious. We should try and watch how we take that information. Again, make sure our social networks are strong. Let's socialize. Let's socialize safely via WhatsApp, via all the other channels, Zoom, Skype, FaceTime. Let's connect, and let also allow our children to be connected to their peers and their schoolmates. Help the children also to visualize the future. Ask them to come up with plans for when things become better, what are we going to do? And not even going that far, let's just stick within the near future, where we are talking, okay, can you guys come together and make the family menu this week? Yeah, can you children come together and make a duty rota for this week? So make them feel like they're important and they're contributing towards the family. Keep positive. Yeah, when children realize that the parent is handling pressure well, they too will learn how to handle pressure well. Keep them in the loop. Even though they're young, you can talk to them according to their developmental level, according to what they can understand. For example, when your teenager asks you for some details, you can be able to tell them, but make sure you stay with them at their developmental level. So watch the little ones, the small ones, the babies. These are usually unsettled, they get quite unsettled by new routines. So watch the tantrums, watch the regression, watch the defiance, watch the acting out, as we've just said. These may actually be signs of anxiety. And if you find that you cannot contain them, you cannot help them, please seek help from a mental health specialist or even a pediatrician. They will be able to direct you in a way that will help you learn how to calm them down. So let's talk a little bit about adolescence. The first psychologist, this is how he defined adolescence. Adolescence oscillates between activity and lethargy, exuberance and apathy, euphoria and despondency, brashness and bashfulness. We can see all these things are on the opposite ends of the spectrum. So an adolescent may be happy 1 minute, and the next minute is not happy for some reason or another. Yeah, an adolescent may be active today, doing everything, doing the chores around the house, taking care of siblings. The next day, not willing to do that anymore. So we need to be aware of this as we are dealing with adolescents, as we're dealing with these young people. World Health Organization says adolescence is a person under 18 years, but there are other overlapping terms that report that youth are between 15 and 24 years. So we'll talk a little bit about youth and adolescence. WHO actually mentions that the term youth also continues to the mid-30s. So all those people fall basically into this criteria. So before COVID, Worldwide, about 10 to 20% of children and adolescents we know experience mental disorders during this period of adolescence, and maybe even before. Yeah, half of all mental illnesses begin by the age of 14, and 3/4 of all mental illnesses begin by the mid-20s. Yeah, so according to WHO again, neuropsychiatric conditions are the leading cause of disability in young people, in young people worldwide. So what is the main issue? I think from what I've seen in my practice and from what I hear from my child psychiatrist and child psychologist colleagues, self-esteem and self-concept, especially during this time of adolescence, is a major, major issue. It is a precursor to many, many adjustment problems and impacts mental health directly, a major cause of anxiety, depression, and even issues around sexuality. So the mental health issues in adolescence include anxiety, depression which includes cutting, burning, and other self-injurious behaviors, conduct disorders, eating disorders, substance use, and sex and sexuality issues. So just before I talk about anything else, I want to talk about self-harm. So self-harm, we've seen, is an increasingly pervasive symptom of emotional distress among adolescent girls, but also some boys. Yeah, it involves physical damage to the sufferer. Cutting understandably evokes distress and fear in others. Well, children who feel, or adolescents and children who feel a high amount of emotional pain sometimes resort to cutting themselves to relieve this pain. Yeah, so this may be, and is not always so, a precursor to suicidal behavior. So it must be taken very, very seriously, and help must be sought. The impact currently of COVID-19 on adolescents includes apathy. Imagine waking up in the morning and there is nowhere to go. There is nothing to do. There are no new plans. You know, the feeling of hopelessness, the feeling of being useless is very, very prominent right now among adolescents. So in this case, we end up seeing more and more cases of depression. And these cases of depression are made worse with a strong sense of hopelessness. Like, what is there to do? What can we say? What can we do? There's anxiety, and anxiety, a new source of anxiety is about the parents losing their source of income, and therefore the child losing the way they've known that they've been living. That is quite prominent among children. And I personally have seen a lot of issues recently around sexuality, with up to 12-year-olds, 14-year-olds coming and saying, I'm gay, I'm bi, you know, this and that, where they're reading maybe on the internet, they're discussing amongst themselves, and they're getting more and more confused about their sexuality. We see problems with pregnancy, substance use. Poor parenting sometimes contribute because we have not been used to having these children since they were 4 when we sent them off to school, and then they went off, especially the adolescents, into boarding school, and we find them, they come back in November for the long holidays, and we send them off to camp, and we really, really do not have any idea how to parent them anymore. Yeah, but also we have become society where we don't do community parenting anymore, and that is a problem, because then we don't have our neighbors checking up on our children and seeing what they're doing and intervening where they need to intervene, and that is something as caregivers we really must check. Yeah, so the social isolation and distancing, the interruption of school. We know adolescents during this period, children really, really need to interact with their peers, because that's how they develop at this stage. They need less of their parents and more of their peers, but their peers are not there right now. They are not allowed to interact with their peers. So this is a great source of anxiety and a major, major source of depression. Fear of and worry about health. lack of the support of teachers. We know our adolescents tell us how much they hate the teachers, but I'm telling you, these teachers really hold up these children. Exposure to more parental stress, more parental anxiety, whereas they wouldn't be seeing what is going on. They won't see us when we don't have money and when we are worried. Right now, they're right in the mix of it, and they lose the comforts of just knowing that the parent is there for them. Yeah, and for as mentioned before, there's also a bit of abuse and trauma, especially for the girls who may already be in an abusive environment, or who may be in a newly abusive environment where everybody is home. Maybe you live with brothers, maybe you live with uncles, and this, of course, provides a lot of problems. So just a quick mention on depression. And we've said that mood problems actually are common among adolescents. But how do we know when it is actually depression? How do we tell the difference between sadness, which is quite common among adolescents, and depression, which is more serious and clearly needs intervention? So when there is depression, we will see increased social withdrawal, where these children isolate from their parents. They also isolate from their peers. They don't even want to talk to them on WhatsApp or on Instagram or whatever other social channel they use. They change their peer groups entirely, or they just keep off. You will notice this child is sleeping more. Yeah. You will notice they don't want to go to school. Their performance, if they were a child who are doing well in school, suddenly drops. You will notice more substance use issues where they want to self-medicate so that they feel better, they feel more upbeat. You will notice a lot of self-criticism in these children, where they say they can't do anything, they feel like they can't do anything right. They feel that even the chores you are giving them, when you complain, why did you not do it? They'll tell you things like, oh, I'm so stupid, I'm so dumb, you know. So when these things happen more rapidly, when they happen more consistently, when all of them are occurring at once, we actually do need to take action, yeah? So how do I help my child, my adolescent? Yeah, love. Show lots of love, lots of acceptance. Even if they don't want it, they appear not to want it, I assure you they notice it. Focus on them. For the younger ones, play with them. For the older ones, listen to them when they talk. Yeah, a lot of adolescents who come to my clinic, for example, will say, my mom, nobody listens to me. Nobody understands the things I'm saying. Yeah, so let them lead some of the things that they can lead at their age. Yeah, provide structure, provide rules, but also be very, very consistent. Yeah, when you say, I need you to do this and this and this, if you don't do it, this is going to be the consequence. Let the consequence be actually there. Catch these issues before they're out of control. If you notice the symptoms I've mentioned in your child, symptoms of depression, symptoms of anxiety, these issues around sexuality, substance use, notice them and get help or intervene before they get too serious. Yeah? Tell your child, make sure your child knows that when they have done something good, you're happy. And help them so they can cooperate, so that they can continue to do these positive things. But don't just say good. Tell them, oh, I like it that today you swept the house. It's so clean. You know, explain what you're happy about and what you find good about their behavior. Yeah, help them to find something they're good at. Are they good at drawing? Are they good at art? Are they good at a certain sport? Yeah, help them to find that thing and make sure you encourage them, yeah, to continue with the thing that they're good at. Support them and offer genuine praise, yeah, but don't overpraise. Be careful, because sometimes we'll praise a child, a 5-year-old, for brushing their shoes. This is something that they should be doing. Or we'll praise a 10-year-old for making their bed. This is something that they should be doing. So as much as we'll praise it maybe the first time, the next times we don't praise it, because now we are looking to praise for something that is higher above their developmental level. Help them to learn from their mistakes and not to beat themselves up. Yeah. Provide them with responsibilities and opportunity to contribute to the home. As I said, imagine waking up and there is nothing for you to do. Your parents have not left you any chore. You've watched every movie on Netflix, or you've taken DVDs and gone to watch. You've scrolled your phone. You've done everything that you could do, and there is nothing else. We may hate the chores, but a lot of us will testify that those chores that our parents used to give us actually have made us to be hard workers. They have made us who we are. Yeah? Be a role model for your child. Show your child what it means to love yourself. Be willing to do and try new things, and show them how you cope with setbacks and challenges. Yeah? Reward patience and persistence, and show them to do things well, not just to wash the dishes and just wash them really badly and dump them in the tray, but just to wash them or to do something very well from start to completion. Create a safe, loving home environment where the child feels comfortable, where there is not much argument, there is not much fighting. Yeah, this is very, very important. Yeah, share your feelings even around COVID. Yeah, so that the adolescent also feels that their feelings are actually normal. Avoid expectations of adult behavior. A child is not a short adult. A child is a child. They can never behave like adults. Allow them to be their age and their stage of development. Allow questions, provide honest answers. Yeah? When the child is upset, comfort them with cuddles, comfort them by talking to them. Yeah? Don't forget to emphasize the regulations that have been put in place: social distancing, washing your hands. Remind them they could be asymptomatic, they could infect others. Emphasize to them that their friends could actually be positive but asymptomatic, so that they know what is going on. Most important of all, make time for yourself as a parent so that you are able to be a good parent. Get the space to decompress, walk, read, watch TV, do whatever it is that you do. Make healthy choices, eat properly, have good physical activity. Do not drink to drown the stress. That is not a good coping mechanism. Make sure that you are a good role model for these children. Make sure you are a good role model. Be realistic about the situation. Yeah? Don't try to be perfect. COVID-19 and perfectionism don't work well together. Set realistic expectations for your children. Yeah? Give yourself some grace if you cannot meet your own expectations, because sometimes we really, really set high expectations for ourselves. Be forgiving to yourself, and also have some compassion, some self-compassion for yourself. Yeah? And I think that ends our talk for the day. Thank you very much for watching this video, and please remember to stay safe, keep your mask on, sanitize, and social distance. Thank you.